process of doing on Ann today is one of our most advanced lasers that we have at Infinite Cosmetics, and we're very, very proud to use it here in the clinic. It's called fractional resurfacing. This particular laser that Lisa, one of my laser experts, is using on Ann is called a profractional laser. And as you can see with Ann here, the very interesting thing about this laser technology is that rather than burning the skin or causing a lot of trauma on the skin surface, what this laser does is shoots hundreds of thousands of tiny little pixels or wormholes into the skin. So it essentially bores out the skin surface. We will treat Ann's whole face, but in essence, the laser is selectively only boring out or resurfacing about 15 to 18% of the surface area of the skin. You can see with Ann, we will treat Ann's whole face, but in essence, the laser is selectively only boring out or resurfacing about 15 to 18% of the surface area of the skin. You can see with Ann that she's getting a little bit of pinpoint bleeding on the face, and that is entirely expected and normal with this particular laser. But Ann, has the laser during this treatment, has it really hurt that much?
No, it's just like a warm, tingling feeling.
Okay. So, a little bit of tingling of the skin and a little pinpoint bleeding, but once we clean her up here after the procedure, you're going to see that she'll be able to apply foundation or light powder and be able to go back to work tomorrow. With this particular laser, it typically takes about 3 to 5 treatments. Is that correct, Lisa?
Yes, 3 to 5 treatments.
About 3 to 5 treatments spaced about 1 month apart. And then during that time, the skin will be about 70 to 80% resurfaced. And the changes that Ann is going to see in her skin is going to be improvement in the texture of the skin, in the very fine lines underneath the eyes, around the mouth. She's going to see changes in the tightness of her skin around the eyes and in the jawline from this laser. She's also going to see dramatic changes in the pigment in her skin. Brown spots, redness, a lot of those things are the things that we find patients are the most excited about.
Yeah, they're the happiest.
When they return to the treatments. So Ann, what we're going to do now is we're going to continue and finish off the rest of the treatment, and then we'll get you cleaned up and on your way, okay?
Okay.
Are you doing okay, Ann?
Yes.
Very good. Now, with this laser too, we can treat right up underneath the eyes. That's very important for a lot of our clients because they want to achieve that rejuvenation underneath the eyelids. Are you doing okay, Ann?
Yes.
Very good. All right, you're open your eyes. You did great, Ann. Now we're going to get you cleaned up. And we'll get you on your way. So, Ann, as she's cleaning you off, I'll just explain to you a little bit about the process. I know we've talked about it before, but just to reiterate. So this laser, the great thing about it is we started with a pretty low setting today, and you tolerated it very well. You're going to have about 2 to 4 more treatments in the future with this laser, but at this low setting, we like to start that way so that you'll be able to see exactly the power of this laser. And then you direct us on the future treatments. You can come back and say, Dr. Hall, I really enjoyed my last treatment. It was the perfect amount of redness in my face, and I was able to go back to my normal activities, so I'd like to continue at that setting. Or you may come back and say, I'd like to see even more change in my face, so we could possibly increase the amount of energy that we use in the future treatments. So it really is a true lifestyle laser, and we can dial it in to any of our patients' particular needs. So, Ann, now that the whole thing's done, how do you feel?
I feel fine.
So not a lot of pain?
No, not at all.
You just have a few areas of redness, but like I said, most of that redness should be calmed down by